People process stresses differently, and leukemia patients are no exception. The first reaction that could happen is about, if somebody was going about their lives normally, attending school or college for work, and suddenly that has stopped. So there is a feeling of loss of control over one's life. This feeling of being out of control or numb usually is transient and it passes. We encourage all patients with leukemia to talk to their friends and relatives so that they feel lighter and feel better. And informations also help to know about your condition, to learn what awaits you over the next few months during treatments also would give you some control back about how you plan your life. Psychiatrists like myself, we often see patients with leukemia, and we support the patient and their family members as the need may be. We encourage common sense measures like indulging in leisure activities. So you might like to watch movies or listen to music, and not always worry about your condition, because you are a person and you are still a person, and you are just not a leukemia patient. So it's important to have that angle when you deal with your own emotions. Now, if you feel sad and upset, or you're feeling tired, your sleep is fragmented, and you don't feel like eating, you're feeling low in mood, you feel hopeless, and these symptoms go on for a while, you might fulfill the condition of a clinical depression, in which case it is better off if you consult a mental health professional and you could, be assessed formally. Following an assessment, mental health professionals like myself, we might, prescribe medications for you, or we might want you to see a psychologist for psychological support and therapy. This also needs to go hand in hand with the other common sense measures that we are talking about. Most patients get better with mental health interventions, and leukemia and mental health conditions, even though they may co-occur together, but good news is both are curable. So we encourage you to look after your body and your mind during the time of diagnosis, during treatment, and even after you have got better. See, you have to go back to your normal life. So some patients might have fear that what if the disease comes back, and we call this a fear of recurrence. And we would encourage you to, not think only about the disease coming back. And this fear of recurrence sometimes has to be formally tackled by psychological methods, because it's important that you live your life fully. We hope this journey makes you sort of understand how important it is, the small things of life, and you become a better person after you've been through this.